So like we said before, somebody's pain is always real, even if we sometimes see that there is no good reason in the tissue for the pain to be still so intense. This should have healed, everything looks like it has healed, but that person is still experiencing pain. I was talking a little bit about how our levels of anxiety in general, or how we perceive the world around us as potentially dangerous, might really amp up the signal of potential danger. So that's a big factor. And we also know that different people just have different pain thresholds in general. And that's why it's so hard to compare whether somebody's experience is real or not. And so, in my opinion, the best way to see it is to just say it's always real, because that person is suffering and pain is suffering. So, from here, we look at how to help that suffering. And we really got into studying pain better when we were doing placebo studies. Now, you know, placebo studies are done all the time in order to figure out whether a new treatment or medication, or even an old one, is performing well and is actually having a good enough effect. In a placebo study, usually you have one group of people who get the real treatment or the real pill with that substance that we're testing for, and you have a control group that is receiving a placebo. We started doing that because we found out that any treatment has an effect, even if nothing is really being done. So we can't really control people who get a treatment just to people who get nothing. There always has to have something happening, because any kind of therapeutic interaction has an effect. Usually we call that the placebo effect. So when you read a study and you find that in a control group that was given a placebo, there were no effects at all, in most cases you know that the study was wrong to begin with. Something is foul there. Now, in placebo studies, what was found out pretty quickly was that when the study was about pain instead of inflammation, or instead of sense of vertigo, or in a lot of other symptoms that have nothing to do with pain, in pain there was always a lot of success in the placebo group. And that was a bit confusing for the researchers. So we would find that in some cases, the placebo group was so happy with the treatment that they wanted to tell everybody about this new amazing drug that really fixed all their issues suddenly. But they were the people in the placebo group. How is that possible? So this led to all these ideas of all pain is a hallucination, or it's all in your head anyway, or a lot of people just make this up in order to get more attention. That's where it's really coming from. But fortunately, the researchers realized that this just has to do with how pain is processed in the brain and how little other information the brain is getting to figure out how to modulate this experience, just because it's so subjective and it's very hard to compare with the environment and with other people. So in placebos, keep in mind, on pain there is always a big effect, even if they're just getting a sugar pill. They will respond, people will usually feel better, and they will sometimes be really excited about this new treatment.